The Axiom-4 mission is back on Earth. The spacecraft made a successful splashdown today in the Pacific, and Group Captain Shubhanshu Shukla of India was the pilot, and he conducted several experiments. And the entire crew conducted at least 60 experiments, very crucial, and many medical studies also have been conducted in this historic mission, and one of them is Sweet Ride, viewers. Now, it's a research project that was carried out on the Axiom-4, and we have the clinical lead of the Sweet Ride project. Dr Mohammad Fityan joins us here on Republic Digital Podcast, and he's also the CMO at Burjeel Medical City. So thank you so much, Dr Fityan, for joining us on Republic. And of course, first of all, it's a successful splashdown, and many experiments are in focus. But talking about Sweet Ride, it's centered on study about how diabetics could travel to space. Right now, the scenario is that anybody who is insulin-dependent diabetic cannot go to space. So if you could help our viewers understand that, how does this study really help in that?
Absolutely. Well, first of all, thank you so much for this great opportunity to talk about. Indeed, it's a very exciting experiment for us at Burjeel Holdings. And we're looking at three things in Sweet Ride. So we are looking at how the blood sugar in our bodies behave in space. In space, it's a stressful environment to the body when it comes to mainly microgravity, changes in the temperature and radiation. So we're looking at how is our body reacting to this environment. How is this going to impact the blood sugar in a healthy astronaut? So I want to highlight that as you mentioned earlier, no diabetic astronaut been to space so far, and actually this is one of our goals to achieve. We are hoping by getting the data from this mission will help us to open the doors to a group of people who were excluded because of their health conditions. So that's one thing. The other thing also, we're looking at the insulin pens. So we have insulin pens on the flight, and we tested them pre-flight and post-flight. We will run the tests to make sure that the insulin is working well, did not get impacted by the environment of the space. Again, this will support us to hopefully in the near future we send future diabetic astronaut, and then we would not worry about the efficacy and the integrity of the insulin. One more thing we're looking at is remote monitoring. We are monitoring the blood sugar live from when they were in the space from Earth. So this will help us hopefully to help our patients on Earth who live in areas with difficulty accessing healthcare, like oil camps or oil fields that are far. So we are excited about all the learnings that will come from this research.
Right. So, what really led to this experiment? If you could help us understand, what was the, of course, sending more people to space, more inclusivity, of course. But is it also somewhere, something like a space tourism, or maybe building in future the colonies in space? What are the factors that really have motivated this kind of a study, sir?
With our vision, we would like to, look at the health, and also, as you mentioned, to make it more inclusive and to get some learnings. History tells us that, like in 1974, from Vikings to it's a NASA project that went to Mars, and just incidental by coincidence, but they were running soil testing and analysis. They came up with some learnings that helped with developing insulin pumps, for example. So we're looking at some learnings that will help us here, help our diabetic patients as well. And also, as I mentioned earlier, telemedicine and remote monitoring. We're talking about diabetes. Diabetes is one of the most common chronic health condition everywhere in the world. If you go, it's around 9 out of each 100 people, they have diabetes. So any learning that can bring to Earth is going to be helpful. Just keep in mind also one thing, when we talk about microgravity and the effect on the body, it mimics certain situations on Earth, like it can cause some fluid shift in the body that is similar to, let's say, bedridden or some patients who are immobilized for days. So any learning from there can help us help our patients with these conditions on Earth.
All right, so it's not just about the impact in space, but also helping the patients on Earth. And of course, as you said, that there are growing cases of diabetes today. India is a case in point. You know, it's for the longest time has been known as the diabetes capital of the world. And Indian astronaut group captain Shubhanshu Shukla is also part of this Axiom mission. So can you tell us that, was he part of this study about the insulin impact?
We are running at Burjeel Holdings. We're running a sweet ride, but with AX4 mission, there are more studies being done. So all the astronauts are supporting all the experiments, and we really appreciate your contribution. It's a short flight; it's only 2 weeks. So they've been doing amazing, and a lot of work have been put by them. So we really appreciate them. So each astronaut is contributing to a different mission or different experiments.
For a layman, if one has to understand what really, if you could simplify, is the impact of microgravity, or when somebody is in space, how does the glucose level or the sugar levels behave?
So we don't expect significant changes, again, because the main impact will be through the fluid shift. It's called interstitial fluid. So with this fluid shift, we anticipate, if any, it could be minor, a fluctuation, whether it's up or down. That's what we're looking for. But again, this is something that we have to do if we are thinking about sending a future diabetic astronauts. We have to make sure their safety is 100% guaranteed, and again, the safety of the medications in the future are already there. So maybe I didn't explain in the beginning. So we're monitoring this through the CGM, continuous glucose monitor. It's a device that they wear, which monitors the blood glucose 24/7. So any up or down, and the average and everything is being monitored. Again, it was monitored live, and then upon the return, we will be able to get all the data back.
Right. In fact, so also there are many other changes that are experienced, in space. So one of the studies, out of these 60 experiments was also on bone loss. So were there other studies also part of Sweet Ride to study more impact and other things?
In Sweet Ride, we're looking specifically at the blood glucose metabolism. Again, we're looking at the insulin pen's viability and integrity. But as you know, diabetes is a chronic metabolic disease. So there are many are there. So sometimes learning points can be applied to other diseases. But in Sweet Ride, we are mainly focusing on the blood glucose and, again, the tele and remote monitoring of data.
Right, sir. And does your mission or your firm does it also plan to conduct even more studies in future? And if yes, then what could be the focus of that?
Absolutely. Again, I think this is only the beginning. We are hoping that this will open the doors to more studies, maybe related to this one. Hopefully, sending the first diabetic astronaut, and also our focus on other chronic metabolic diseases and cancer. So, also cancer is a big field that is impacting us here on Earth. So we are hoping also to be part of any future mission that might help our patients here.
And in your understanding, because the splashdown has just happened, and we saw, Group Captain Shubhanshu Shukla emerging from this spacecraft. He was held by people. So as a doctor, someone from the medical field, and an expert from the medical field, how would you describe the implications, the impact of gravity on Earth when any, a human being, when an astronaut, splashes down or lands on Earth? How, if you could just explain the rehabilitation process, how much time does it take, and what all challenges come up?
So, all the astronauts, they go through intense training, and they go through maybe situations that marks the actual space environment, and they go through intense training. So they go through health checkup to make sure that their health is optimum and there is no issues to be anticipated or expected. But they also go through this training of what to expect, during liftoff or when the spaceship is back. So they kind of more trained, and their bodies are more adapted to the changes. But as you mentioned, I was watching it live, and it was really great to see them coming back safe to us and to their families as well. And we look forward for the results that they will bring to us. We're really excited about the all the learnings that will come.
Right, sir. And Dr. Fityan, I want to understand from you, since you've been working on the impact and working with the, space agencies, you feel that there is now a growing need for more and more studies, and this is somewhere, also pushed because of the space tourism. There's this race for space tourism, and more people, not just astronauts, with any intention of studies, but the common man is also wanting to go to the stars, and everybody wants to have this experience. So you feel that these studies, because if I want to go to space tomorrow just for the sake, just want I want to just carry out and be part of this adventure, so to speak. I will of course be wary of how if I am fit for it or not. So you feel that the more and more people are now going for this for space tourism, and which is in fact pushing more of such studies.
So, yeah, this might be not the primary, but you're absolutely right. Like when we're talking about a new environment, and let's say this is going to be just expanding more and more. It's not only about being diabetic. You would be interested when you go to space. How is the space going to impact your body, right? You're worried about that. Again, that's only one part of it. The others are doing the other studies involving other organs and other systems. So definitely these learnings will help even future travelers to space, let's say, and then to ensure their safety.
Right. Dr. Mohammad Fityan, thank you so much for joining us on Republic and sharing your views, and of course, more importantly, about the research that has been conducted on the Axiom-4 mission.
It's my pleasure. Thank you for having me.
Thank you, sir.